You're probably aware that certain nutrients can support optimal vision, but did you know your hearing may benefit from certain foods as well? If you have trouble hearing, or notice that your hearing is not as good as it used to be, your diet may hold the answer. In fact, nutritional imbalances are increasingly thought to be a causative factor in hearing loss. Age-related hearing loss is actually not due to any kind of mechanical dysfunction in your ear. Rather, it's how your brain processes information that results in reduced hearing. Among the nutrients found to be most beneficial for protecting and improving hearing are carotenoids, especially astaxanthin and vitamin A, folate, zinc, magnesium. These nutrients support hearing in a number of ways, including protecting against oxidative stress in the cochlea, preventing free radical damage, improving blood flow, thereby reducing cochlear damage related to a compromised vascular system, improving homocysteine metabolism. The support for vitamin A is mixed. In one large study that included data from more than 65,500 women, no correlation was found between vitamin A intake and risk for hearing loss. Folate may improve tinnitus. For noise-induced tinnitus, which is characterized by a chronic or near-chronic ringing in the ears, folate, vitamin B9, has been shown to be beneficial. Folate also lowers your homocysteine, and having a high blood level of homocysteine has been linked to age-related hearing loss. As a general rule, the ideal way to raise your folate levels is to eat plenty of fresh, raw and organic leafy green vegetables. Folic acid is the synthetic form typically found in supplements. There is good reason to consider getting your folate from food rather than folic acid supplements. In order for folic acid to be of use to your body, it must first be activated into its biologically active form L5-MTHF. This is the form that is able to cross the blood-brain barrier. Asparagus, spinach, turnip greens and broccoli are all good sources of folate, as are beans, including lentils and garbanzo beans. Zinc for sudden hearing loss. Research has shown zinc may be useful for idiopathic sudden sensorineural hearing loss. SSNHL, a sudden unexplained loss of hearing, is typically treated with high-dose steroids, even though steroid treatment is controversial and evidence to support their efficacy is limited. Zinc has antiviral properties, and studies have shown it can prevent common cold viruses from replicating or attaching to your nasal membranes. Zinc also has immune-boosting properties, allowing your body to mount a stronger first response at the onset of a viral infection. Intravenous magnesium may also improve sudden hearing loss. Intravenous magnesium has also been shown to improve SSNHL. In one study, 48% of SSNHL patients achieved recovery after receiving intravenous magnesium in combination with carbogen inhalation. Another 27% experienced significant improvement. Factors that reduced the effectiveness of the treatment included vestibular symptoms and delaying treatment for more than 8 days after onset. Increasing NT3 production restored hearing. 2 years ago, researchers looking at ways to restore hearing lost due to noise came upon an interesting finding. By increasing the production of a protein called neurotrophin 3, NT3, they were able to reverse hearing loss in mice that had been partially deafened by loud noise. There are only two main sources of natural astaxanthin, the microalgae that produce it, and the sea creatures that consume the algae, such as salmon, shellfish and krill. If you decide to give astaxanthin a try, I recommend starting with 2 mg per day. Boosting BDNF may also improve your hearing. Earlier research has also shown that, in addition to NT3, brain-derived neurotrophic factor also plays an important role in the development and survival of auditory neurons in your brain. One 1996 study found that loss of auditory hair cells and auditory neurons can be prevented by therapies that boost either NT3 or BDNF. Interestingly, one lifestyle factor that naturally boosts BDNF is exercise. Part of what makes exercise so effective for preventing cognitive decline is related to a boost in BDNF. It's intriguing to speculate whether exercise may also help prevent hearing loss through this mechanism.